We're all going to have to get used to wearing a face mask. From flights abroad to your local supermarket, masks or face coverings are now an essential bit of kit in England. So why the sudden change?
Because the pandemic is not yet over.
Well, the evidence has been growing that people can transmit COVID-19 even when they don't show symptoms. They might feel well, but they can still breathe out the virus. So it makes sense to do whatever you can to reduce the number of virus particles potentially reaching other people. Social distancing, at least 1 metre, ideally 2, is by far the best way of doing that. But the World Health Organization, the Royal Society and lots of other scientific bodies now agree that when that's not possible and you're in an enclosed space, a face covering can reduce the chances of the virus spreading. By how much? It's impossible to give you one easy number. There are big differences between studies. But to give you an idea, a study in the Lancet Medical Journal found the risk of passing on the virus when wearing a mask was 3% compared to 17% when not wearing one. What about different types of masks? Well, without doubt, the most effective is the respirator mask. They're close-fitting with a good filter and they reduce the risk of being infected as well as passing on the infection. But they're in short supply and medical bodies want them reserved for frontline health workers. Next up is the surgical mask. There's not yet much evidence that they protect the wearer. But if they're infected, it does catch some of the virus in their breath, reducing the risk to other people nearby. But again, supplies are meant for health workers. Face coverings are what the general public are being asked to use. They're made of fabric, usually cotton, and that traps the virus. And the tighter the weave of the material and the greater the number of layers, the better. And it's ideally going to have a wire on the bridge here to make a close fit around your nose. But this is the really important bit. Masks should never be shared. They should be washed after every use, ideally at 60 degrees. And before putting them on or taking them off, you should wash your hands or use hand gel. And even with a mask, social distancing is still just as important. All this will take some getting used to. Masks have been widely used in Asia for many years, but in some European countries they've quickly become a common sight as the virus has spread. In Spain and Italy, more than 4 in 5 people now wear them. In the UK, it's just a third. But this will soon be the new norm.